Hello, I'm Natalie. I'm an RN in IBCLC, and I'm here today with Lindsay.
Hi.
She is about 36 and a half weeks pregnant, and she is going to demonstrate antenatal hand expression for us today. This is also called colostrum collection or colostrum harvesting. You might not know this, but during your pregnancy, about 16 weeks gestation, your body already starts to make milk. And what's really, really awesome is we can actually collect and store this milk at the end of pregnancy to use for baby in the future if needed. So why do we care about colostrum collection in the first place? According to the 2020 CDC breastfeeding report card, almost 20% of breastfed babies are supplemented with formula in the first 2 days of life. That's a really, really high number. The supplementation in the first 2 days of life can be for many different reasons. One of the big ones is actually moms that have gestational diabetes. Their babies are at higher risk for low blood sugar after birth. So women who do have gestational diabetes or diabetes type 1 or 2, antenatal hand expression is a great thing to do so that you can prepare to have extra colostrum in case your baby needs it. There's also a whole lot of other reasons that baby might, so I think it's a good idea for everybody in pregnancy. So colostrum is known as liquid gold. It tends to be a deep dark yellow color. However, it can also range from clear to gray, so don't worry if it doesn't look as yellow as this. Colostrum does have a very thick and honey-like consistency. As you can see, Lindsay actually already expressed some of this. Because of its consistency, it's very, very thick. We find antenatally or in pregnancy, hand expression tends to be better than the pump at getting the colostrum out. To use the colostrum collectors, there's two ways you can do it. The first way is to use the suction option. This will help pull off some of the drops off the nipple. I find if there's only a few drops, this is the way to go to make sure that you don't lose any of the milk. For a tutorial on the steps for hand expression, please see the link in my hand expression video. The second way that you can do it is you can actually take off the entire top. I feel that this is a little bit better when you have more drops of milk coming out. Don't expect to see a whole lot of colostrum, especially as your placenta is trying to hold back the milk. On average, with antenatal hand expression, women can express about 5 mLs per session. The collection containers that we're using today for antenatal hand expression are the Haakaa colostrum collectors. These guys are so awesome. They're plastic-free, made of silicone, they're freezer and heat safe, and they're also reusable. So Lindsay just finished expressing. She got 4 mLs real quickly, which is so awesome. Once the lid is on this, it's actually leak-proof, so you can put it on, not worry about it spilling. What was your experience about using it with the suction method versus the lid off?
Both were quite easy. I felt like for me personally, I liked the lid completely off. It was just a little bit easier for me to get my droplets in and then closing it back up.
Yeah. Awesome. Unless you're having a planned delivery, I would recommend dating and storing your milk in the freezer, as breast milk is only good in the refrigerator for 4 days and it'll safely stay in the freezer for up to 6 months. You can use this anytime in your baby's first 6 months of life. Because antenatal hand expression does use nipple stimulation, it does have a little bit of oxytocin response, which can increase your risk for uterine contractions. Because of this, it's best to wait until you're about 36 to 37 weeks pregnant so we don't induce preterm labor. The general recommendations for hand expression are about 2 to 3 times a day for a few minutes. Sometimes you can go up to 10 minutes, but you generally don't need that long, and you can work your way up. You might want to start with just 2 to 3 minutes and then work your way to 5 minutes. So with hand expression, you might get a little bit of cramping. It should be light. It shouldn't be anything consistent. If you start to get some strong, painful contractions, please stop immediately and contact your OBGYN or your midwife. Some people are worried about antenatal hand expression if they take out the colostrum, that they might not have enough for their baby when the baby comes. But it's actually, the colostrum will continue to replace itself until the placenta is released and triggers the signal of increasing your milk supply. So you can antenatal hand express for every day if you want. After 36 weeks, you're not going to run out of colostrum. I hope this information was super helpful for you, and I hope that you were able to start collecting some of that liquid gold. Let me know if you had any questions.